Thanks for coming on the line with us today, folks. My name's John Dubas with Premier Marketing, and we'll be spending the next 45 minutes to an hour or so taking a fresh look at AmeriGroup and the possibilities you have with this national carrier in the great state of Texas. I want to thank you for coming on the line and investing your most precious resource with us, that of your time. Today's presentation is being recorded, and it, along with a number of resources that we'll reference throughout the course of the presentation, will be sent to you by email as part of follow-up to today's presentation. That will come to you probably later today or first thing tomorrow, so watch for that and we'll follow up for any additional questions. As a bit of a level set, I want to give you some information about Premier Marketing. For those of you who are familiar with us, a bit of a redundancy, but we're a national marketing organization founded in 1968 that's part of the Integrity Marketing Platform. We have offices across the country. We act as an insurance wholesaler, providing services through independent insurance agents such as yourself, with contracts that are vested at the highest possible commission levels available, with recruiting contracts available for those who qualify. I mentioned we were founded in 1968, so last year was our 50th anniversary. And that's a very strong milestone considering that we started as a small family agency in rural Nebraska, and we've grown into one of the largest producers in the Medicare arena for both Medicare Advantage and Medicare Supplement programs. That portfolio that we offer that enables us to achieve that status in partnership with agents such as yourself includes a full gambit of Medicare programs, including Medicare Advantage and Medicare Supplement plans, and standalone Part D prescription drug programs. Our life insurance and annuity portfolio is very robust and includes final expense life insurance and pre-need programs. We also offer long-term and short-term care programs, disability income plans, and ancillary benefits such as dental, vision, and hearing programs, critical illness and cancer plans, and hospital indemnity programs. That Medicare Advantage portfolio includes all the big boys and many of the strong regional carriers that can make a difference for you in your market. That same philosophy carries over into the standalone Part D PDP portfolio with the major carriers available through our organization and a viable part of a portfolio for an agent who concentrates on the Medicare Supplement arena, because we've got a ton of them as well. And also some tools that can make that a very viable part of taking care of the entire gambit of the Medicare market. That ancillary products, well, it includes the major carriers in those subdivisions, but it's important to note that these can be very viable ways of growing your book of business through lock-in and also create additional revenue streams for you and your agency throughout the course of the year. Needless to say, too, they are very viable ways of protecting the folks that you visit with, your prospects and your clients. The Medicare market as a whole, well, it's a very large and robust market, as I'm sure you're aware. You come on the different presentations like this, and marketers such as myself and carriers such as Anthem will speak to you about the growing opportunity we have in this arena because of the aging of the baby boomers. We're 10,000 people a day are turning 65, but that's only a portion of the Medicare market, a large portion of it, but about a sixth of the Medicare market is under the age of 65 and are covered by Medicare because of disability. They are very viable candidates for us to help, simply because the Medicare Advantage programs and the prescription drug programs offer the same benefits regardless of a Medicare beneficiary's age. That Medicare population is also very diverse in its needs. A large number of the beneficiaries, well, 2/3 of them have 3+ chronic conditions. 22% of them have 6+ chronic conditions. So we're dealing with a population that really needs our help and are very subject to financial exposures that come as having just original Medicare. One of the things that makes that difficult for them then, obviously, is the fact that the median income for a Medicare individual as of 2017, 2 years past this chart, Well, that median income is $26,200, so they really need our help in looking through and examining the options that they have to take care of the shortfall that they have with original Medicare. Medicare does dictate when we can help people as well, and what we see here is the things that have happened in the near recent past. So in the annual election period, obviously that goes from October 15th through December 7th. You see a period of time where you have an opportunity to change those choices now with the change from the MADP period to the OEP period, which ended just this past week. That leaves us then with special election periods and the options that they make available for us to help individuals throughout the year. This gives you a nice piece of information when it comes to a listing of those special election periods, your get out of jail free cards, so to speak. And if you think back to the characteristics we saw in the Medicare population, between the chronic conditions that they're subject to, the income constraints, the moves that a person has when they retire, and other reasons why they may be eligible for a special election period, we have the opportunity to help people all year long. Additionally, for the folks who are best served by a Medicare Supplement program, well, those plans are changing as of the first of next year as well. The plans themselves aren't, but the availability of those programs are. Because of the MACRA legislation, folks who are newly eligible to Medicare will not have the option of picking up a C or an F plan after January 2020. The plans aren't going away. They'll still be there for folks that are already on original Medicare. It'll just be interesting to see what happens to the rates when the younger population can no longer access those plans. This slide gives you the opportunity to look at those plans on a side-by-side basis and incorporate in the 2019 numbers. This tool gives you the opportunity to help evaluate those programs, and it is available to all agents who contract with Premier Marketing at no cost to them. So that said, let's roll into the opportunity that we have to look at the options that you have with AmeriGroup in the state of Texas. And today, as our guest speaker, we have Ms. Renee Brown, who's the Regional Sales Manager for Medicare West here in DFW in the Lubbock area. And Renee is going to walk us through some of the benefit options that we have with AmeriGroup. And Renee, give me half a second. I'm going to turn over control to you and shut up and let you go. And there you go.
Thank you, John. Let me see here. Let me share, see how I can share my PowerPoint. Are you able to see 2019 Texas and then 2 women in the pool?
Yep, we're ready to go. Let's swim away.
All right, great, thank you. So thank you again. Thank you, John, and everyone at Premier for having myself today. And thank you all for attending. I just wanted to come in and talk to you a little bit about the Medicare Advantage plans we have here in Texas. As John mentioned, I am Renee Brown. I am the Regional Sales Manager. I cover Dallas-Fort Worth Metroplex as well as the Lubbock area. I am here to assist you as the agent in anything you need from quoting to plan questions, marketing materials. My contact information is on the screen there. You can email me, that is my cell phone number. You can call me or text me, whatever is easiest for you. I am here to help you sell. That is my responsibility. Just a little bit about me. I have been in insurance for a little over 20 years. I joined Anthem late 2018 and really enjoy working here, working with the agents here in the Metroplex and working for Anthem directly. Before I talk to you about the different plans that we have available, I want to go specifically and give you a little more detail about who we are. AmeriGroup's parent company is Anthem, which is headquartered in Indianapolis, Indiana. When your clients choose AmeriGroup, they're getting the strength of a national company with the personal approach to service and caring. AmeriGroup is committed to helping members get the tools they need to live healthier lives. AmeriGroup is one of the nation's leading Medicaid managed care companies focused on the healthcare needs of financially vulnerable Americans and effectively managing state-sponsored programs. So many of you probably, with the AmeriGroup name, you connect it automatically with Medicaid. Traditionally, we are a Medicaid company here in Texas. Now, Anthem is the largest independent licensee of the Blue Cross Blue Shield Association, affiliated in 14 states from Maine, Georgia to California. We are not the association. We have the license to brand ourselves, and in Texas, we are branded as AmeriGroup. This slide here, you've got measures and metrics to the left. To the right, our customer base, and then in the very bottom there are some subsidiaries of Anthem. A couple of things I want to mention here. There's over 73 million people that are served by one of our affiliated companies, including approximately 40 million within our family of health plans. Anthem is one of the nation's leading health benefit companies. We are the second largest health insurer in the nation. We are number 29 on the Fortune 500 list. We insure 1 in every 8 Americans. So a total of over 73 million lives served. Down at the bottom under subsidiaries, you'll see the first one to the left, CareMore Health. This is an Anthem-owned care model. We just brought the first one to Texas. It is actually in Fort Worth, down off of Rosedale. This is a one-of-a-kind, unique facility that, as I mentioned, is Anthem-owned. It's a primary care clinic. It goes well beyond just primary care. This particular clinic has not only primary care doctors, they have social workers, and they are also mobile. This is an office that when you write someone in Tarrant County that is, in that area, you can assign them to that particular clinic and know that they are going to get the best possible care available. If you are interested in doing a tour of that clinic or learning more about it specifically, then please reach out to myself or reach out to John, and we can set something up. Just a little bit about Texas demographics, and I'm sure this is not something that many of you are not already aware of, which is the huge potential we have here with Medicare beneficiaries, agents, and the penetration that that currently exists and the opportunity that is still available. I mean, in 2018, there was 250,000 agents. So every month there is a significant amount of opportunity of Medicare eligible individuals that we can find and sign up. 36% in Medicare Advantage plans and 20% in Medicare Sup plans. Today, I'm going to talk specifically about our Medicare Advantage plans, but I'm also partnering up with John later in the month, and he is allowing me to come on and talk about our Medicare Supplement plans as well. So when you get the invite from him for that one, please make sure you join that as well. This particular map illustrates where we do business at here in Texas. As I mentioned, I handle the DFW area, which includes all of these counties in North Texas. So you've got Archer, Clay, Throckmorton, Jack, Wise, Denton, Collin, Tarrant, and Dallas. And then I also have the Lubbock counties as well. The new counties for us are the ones identified in the orange. Prior to that, here in DFW, we were in Dallas, Tarrant, and Denton. So January 1st, we expanded to 6 additional counties in Dallas-Fort Worth to put us at a total of 9. We are growing, definitely. It's been we started in the 3 and we expanded to the 6. I anticipate we will likely have more for the next year. Before I get started talking about our plans and the benefits that are within those plans, one of the things that I wanted to mention is we are a 4-star rated health plan here. And we have 3 different Medicare Advantage plans. So we have 2 DSNP plans, and then we have 1 classic Medicare Advantage plan. And I'm going to talk about the benefits that come with each of those plans when you present these plans to your client. Each of our plans come with the Medicare Community Resource Group, and this is an added benefit that when your client is an AmeriGroup member, if they have any type of need, whether it be healthcare need or a non-healthcare need, this particular resource group is there to bridge the gap. So they will contact member services who will put them in touch with Medicare Community Resource Group, and they will then put them in touch with different organizations within the local community that can connect the gap, whether it be, help with shelter or food or just a number of things. They're able to assist the member and get them to the right particular community resource. That is embedded into all of our Medicare Advantage plans. One of the benefits that we brought out for January 1, and this is something that is unique to AmeriGroup. You won't find another carrier with anything that is similar to this. This is on our dual secure plan, and it is called Everyday Extras. I like to refer to this as a tailored benefit, a custom fit type benefit. What happens is when a client chooses, or when you sit with the client and they elect the dual secure plan, this benefit is embedded in there. So it gives them 5 additional things to choose from. Now, most of these benefits are already in the plan or in both the dual secure and the dual coordination. The Everyday Extra gives the client a chance to determine which of these 5 benefits is going to best fit their everyday needs. Let's say they are a client who is diabetic and they don't have access to healthy food. They can choose the healthy food deliveries, and this gives them 16 more meals per month in addition to what they're already getting on the plan. So if they chose healthy food, they would get 64 meals a year. They could choose transportation, a personal home helper, an assisted device benefit, day center visits, and then lastly, alternative medicine, which would include acupuncture and then also therapeutic massage. So again, this particular benefit is on the dual secure plan in Dallas-Fort Worth. And when they select that plan, they will then have the option of selecting one of the 5 benefits. The benefit that they are going to, be able to get the most use out of. Let's say they enroll in the plan. They don't have to select that benefit immediately, but let's say the need comes up and, something has happened with their transportation. They no longer have reliable transportation. They can select the transportation benefit, when it becomes a need. Or let's say they did enroll in the plan and they chose healthy food deliveries, and 3 months down the road, they still have not utilized that benefit at all. They can then change it if, like I said, something happened to their transportation and they're in more need of a ride to the doctor or to the pharmacy. They can then change that and utilize that benefit. So it is Everyday Extras. It's on the dual secure. It gives the client the freedom to choose which of these is going to best benefit their overall well-being. And that is the dual secure is, excuse me, on the DSNP plan. All of our plans come with the meal benefit, so the post-discharge and then chronic condition on the dual secure for the meal benefit. We use GA Foods as our meal prep company. They provide nutritious meals, and those are delivered right to their door. One of the other benefits that is also embedded in the plans, and as I discuss these, again, these are benefits that are included in the plans, is the Live Health Online. You may be familiar with telemedicine, and that's for the most part what it is. This is a virtual visit with a physician, or it could be a licensed social worker, so it also covers mental health. This is included in all the MA plans at no cost. So if something comes up after hours and it's not an emergency, but perhaps something that they need to get, treatment for, they're able to utilize Live Health Online 24/7. There is, again, no charge for it. All they need is an internet connection and just register online, and you can talk to a doctor who can then prescribe, a medication, and they can simply go to the pharmacy and pick it up. So saves a lot of time for someone that, doesn't have to make an appointment and then get out to the office. Again, it's available 24/7. Now, the psychology is available 15 hours a day, so little different time frame on that. But again, this is just another added benefit in the plan, in the 3 plans that we offer. Another huge benefit in all the Medicare Advantage plans with AmeriGroup is our personal emergency response system. And PERS, for many of you, probably when you hear that personal emergency response, you may remember that from I've fallen and I can't get up. This is included in the plan. There is no charge. All they have to do is be a member. Do not have to have a physician recommend it. So if the client signs up and this is a benefit that they would like to take advantage of, it's just a matter of them reaching out to member services and letting them know they want to take advantage of the PERS. So again, does not have to be a doctor authorization. I know there are other plans out there that offer PERS. However, some of those plans require that a doctor authorized that the client needs this service. We do not have that requirement. They do not have to have a phone line or an internet connection. This particular benefit, what will happen is it connects to towers in the area, and that is how it connects. Whenever the member decides that they want this benefit and they contact member services, we will then get them over to PERS, and they will determine, what type of lifestyle this individual lives. Are they mobile? Do they need a mobile device? And the mobile device will be one that could be worn as a watch. It looks very similar to, let's say, like an Apple Watch, just slightly bigger, or it could be worn around your neck. So we've come a long way over the years towards not just around your neck. It can also be, as a watch. Looks pretty cool and has a button on it where they just push it. So there's no charge, no monthly fee, again, included in the plan. Now, if the member leaves the plan, we are going to give them a grace period, and then they're going to receive a phone call or a letter from PERS letting them know, hey, you've left the AmeriGroup plan and you do have the PERS device, and if you would like to keep it, this is what the cost is going to be. The cost generally is about $50 a month. This could serve as a retention, because if your client leaves the plan, they're going to get a letter, saying, hey, you've left the plan, we're giving you a 45-day grace period, you can return the device, or it'll be $50 a month effective June 1st. Again, could be a retention piece. This particular device could, definitely give a peace of mind to someone's family member. I mean, we hear all the time about individuals, wandering off with dementia, or, their loved ones can't find them. And this particular device can help in those situations. There was a story that was shared. There was a member that had the PERS on the plan, and her son wasn't able to locate her. So he called in to the PERS 24-hour customer service, looking for his elderly mother. And of course, provided information to validate who she was and who he was calling in. They were able to track down and found that she was on a city bus, and they were able to chime in on her device and, just say, hey, Mrs. Jones, we have your son Robert on the line. He has, is looking for you. He's been worried about you. Would you get off on the next stop, which is, Vaughn Street, so that you can be, reunited with your son. And at that point she did. She was reunited with her son. And so that's just one of like the many stories of this particular device, like assisting people. People live by themselves and wander off, or, unfortunately slip and fall. And, you hear of days gone by when loved ones couldn't get in touch with them. So without me rambling on more about that, that is something that, again, that holds true value and is on all of our Medicare Advantage plans. It's just a matter of the member saying, hey, I'd like to take advantage of that. A lot of times they don't even know that it's offered. So I make sure I, remind agents that this is another selling point on the AmeriGroup plan. This year, we entered into our over-the-counter benefits with Walmart. So not sure if you know, but there is a Walmart within about 10 miles of most areas. So Walmart is probably one of the most accessible retail stores. When a client takes one of our Medicare Advantage plans, they're going to get a generous over-the-counter benefit. It's going to vary, obviously, depending on the plan. So once they enroll in, when they get their kit with their ID card, they're going to also receive a Walmart over-the-counter card and a Walmart over-the-counter catalog. The catalog is obviously going to identify the products that they can go into Walmart and buy with their over-the-counter card. Their allowance is generated per quarter. If they do not use, let's say they enrolled in the plan February, they didn't use all their first quarter allowance, they will roll over. The allowance will roll over quarter over quarter. However, it will expire December 31st. So they can go into the store and use their Walmart card, and it works just like a gift card. So you would get the items as they appear in the catalog, go to the register, scan, and then scan your card. It's really that simple. Or they can order online. And then lastly, they can fax in their order as well. And we're going to talk more about the allowances that come on the different plans for that over-the-counter benefit. If you are already selling your plans and you need over-the-counter catalogs or anything, just give me a shout and let me know, and I can make sure I get you some of those. SilverSneakers. SilverSneakers is something that is embedded into all of our plans also. So not just our Medicare Advantage plans, but also our Medicare Supplement plans. And although I'm not going to talk much about those today, I just want you to know this is a benefit that is on all of AmeriGroup's Medicare plans. SilverSneakers is so much more than gym membership. Your typical gym membership, let's say you belong to, 24-hour fitness, and it's about 25, 30 bucks a month. LA Fitness is about 50 bucks a month. This is not just a gym membership. This is a membership that allows them to go to any of the participating gyms that they have in the area. I know in my area they have LA, they have 24, and then also the YMCA. So this is, you can't put a dollar amount on what this benefit is. And I know there are carriers that have gone away with it. And I know to some people, this is a very important benefit. This helps improve the overall quality of life. They are able to get out and go interact and do fun activities with other people. So this is something that is included in our plan. So let's take a look at the plans that we have here. And the first one that we're looking at, and I'm going specifically over our Dallas-Fort Worth plans, but the first plan that we have is just our classic Medicare Advantage plan. And as I mentioned in the beginning of the call, so it's offered in 9 counties. Archer, Clay, Collin, Dallas, Denton, Jack, Tarrant, Throckmorton, and Wise. 0 premium plan, 0 primary care copay, and then you've got the $25 specialist copay. I'm not going to go through line by, I'm not going to bore you and put you to sleep going through each one of these benefits. You've seen a plan. I'm going to call out here what's different or what I want you to know about the plan. So dental, comprehensive dental on our classic HMO plan, we give them $1,500. We don't put a limit on what you're using it for. You can use this dental for dentures. You can use it for implants. The dental network is Liberty. They have a very robust network here in Dallas-Fort Worth. It is issued, like I said, on a quarterly basis. So that $1,500 is broken into 4 quarters. As far as eyewear, we give them $150 put towards either glasses or contacts. And then if we scroll down to over the counter, we're giving $100 a quarter. So imagine, you know, that's about 30, 35 bucks, depending on how you use it, a month for a client to go into Walmart. And there is an extensive list of things they can go in here and get, you know, whether it be allergy medication or depends. There are a number of things you can go in there and spend that $100 a quarter on. Transportation benefits, we give them 26 trips on this plan. Our trips cover up to 60 miles. I mean, so you could go all the way across the DFW a couple of times on 60 miles. I mean, you can get away on 60 miles. And then the podiatry, you will find on podiatry that all of our plans cover this the same way, which is there's no copay for a podiatrist, and it covers unlimited visits. It's very important for them to get their feet checked out, especially if, you know, obviously if someone is diabetic, that is of the utmost importance that they go in, get their feet checked, get their nails trimmed, etc. Also, one other benefit I'm going to back up and go back up on is hearing aids. All of our plans will cover up to $3,000 for hearing aids. We do not limit that per ear. In other words, we don't say, oh, you can only use $1,500 on your left ear. And so if you only need one hearing aid, you only get to use $1,500. No, you have $3,000 that you can use on a calendar year towards the hearing aid. So if you need 2, you can put that towards both. If you just need 1, you can take the whole $3,000 and put it towards 1. I mentioned we have 2 DSNP plans, and this is the 2 DSNP plans. So you have dual coordination and you have dual secure. And these plans look very similar with the exception of they are going to be rich in different benefits. So it's really going to be a matter of understanding, you know, what the client's need is. If your client has a need for dentures or significant dental work, then you may want to consider looking at the dual coordination. The dual coordination gives $4,000 in dental. I don't know of another carrier that's giving $4,000 in dental. That's $1,000 a quarter that you can use on dentures, implants, any of those services. It is not a reimbursement. They go to a participating dentist, and the dentist is going to bill us for those charges. So if they need the dental, they're going to be on the dual coordination. Again, it gives them $4,000. Over the counter, it gives them $150 a quarter. As far as meals, it will give them 14 post-discharge meals. This plan will also cover erectile dysfunction drugs. So it will cover the generic of Viagra on this plan. May not be the easiest conversation to have, but it is a covered benefit on the plan. So on the right, you have the dual secure. All of the plans are offered in the same counties. The dual secure still has a very significant dental allowance. It gives $1,700 a year. It also gives $400 a year for vision. And the dual secure gives for over the counter $360 a quarter or $1,440 a year. So they had $360 a quarter to go into Walmart, $120 a month to go into Walmart to purchase over-the-counter benefits. This plan is loaded with benefits. It has 60 trips. You have 14 post-discharge meals and 42 chronic meals. So if you have a client that's high blood pressure, diabetic, dual secure may be the best plan for that person. Because keep in mind, in addition to the 14 post-discharge meals and the 42 chronic meals, they also get the everyday extra on the dual secure. So if you recall, that gives them 5 benefits that they're able to choose from to add in addition to what's already included on the plan. That is our 2 dual secure. So again, dual coordination and dual secure are the name of those plans here in Dallas-Fort Worth. If you are not already appointed, ready to sell with us, I hope at the end of this, you go out and get that done immediately so that you can start marketing and selling these plans. We have a number of tools available to you. In addition to mProducer, which is a site where you go in and do the applications electronically. We also have CustomPoint and the Toolkit. So CustomPoint is where you'll go out and order enrollment kits and over-the-counter catalogs. And then our sales toolkit is where we have just a number of marketing materials that are available at your fingertips at no charge. They're all able to be customized for you. We customize them, we print them, and we deliver them. It's only a matter of you going out and ordering them. You can get anything from birthday cards to send to your clients, referral cards, posters if you are in different community centers or working in different providers' offices. If you have events coming up, we have event flyers. If you need any assistance navigating the site or finding the right marketing piece for you, then by all means, please reach out to me. Again, as I mentioned in the beginning, I'm here to help you sell and make it easy for you to sell the AmeriGroup plans. I know that you have options as far as which carriers you present to your clients. And I'm also confident in knowing that we have some of the best benefits out there in the Metroplex. That is what I have. I'm going to go ahead and wrap up. That is what I have for today that I wanted to present you with, just information on our 3 Medicare Advantage plans that we have here. We have plans in Houston. We have our chronic plans. We have plans in San Antonio, El Paso. If you want to get any information on those plans, please reach out to me as well, and I will put you in touch with the regional sales manager for that area. John, I want to thank you and everyone at Premier for allowing me to come in and talk about our Medicare Advantage plans. If anyone has any questions on how to get ready to sell, please reach out to myself or John, and that's what I have.
Awesome. Thank you, dear. One of the things that we want to reinforce out of your presentation is the fact that you'll notice on the screen now the point that Renee led off with the kind of cafeteria of benefits that is, to this point, somewhat unique to Anthem and AmeriGroup. It's a really point of focus for CMS, and they're one of the pioneer carriers that actually took advantage of the opportunity of offering this sort of benefit. And this particular piece of information will come to you as part of the follow-up too. And what you'll note as well is it's reinforced in the call letter for 2020. So I think you're going to see this emphasized moving forward as well in Medicare Advantage programs, and gives the companies the flexibility of offering more varied benefits outside of the traditional, okay, we're going to pay your doctor the difference, but you have a copay type of situation. So it's a really interesting and innovative type of benefit that's being pioneered by Anthem and AmeriGroup, and we appreciate that from them. One of the reasons why we want to continue just a little bit longer in today's presentation is to give you not only the opportunity to see why you need Renee's help in North Texas and Anthem and AmeriGroup's help across the state, is the fact that we at Premier will give you some additional assistance as well. One of the things that we do is make the contracting simple, in a manner of speaking. With Anthem, it is an electronic contracting system, and we will make certain that we take care of that. But if you're looking to fill out your portfolio, you can actually create an agent profile, Insurance Bay, and contract with a number of carriers electronically to make that simple and thorough and easy to do. We also offer discounted errors and admissions coverage to our agents. There are sister marketing organizations out there that may add you to their blanket E&O coverage, but it's only for select carriers that you contract with through them. And as an independent agent, most folks contract with a number of organizations to offer a portfolio of products. This program enables you to pick up E&O coverage at a discounted rate and have it cover everything that you offer, regardless of whom you contract through. We also offer a means for you to discount the continuing education that you need in order to maintain your license. There are a number of us that are grandfathered, but we still have that little piece that we have to take in order to offer Medicare products on an ongoing basis as well. So that's available to you through our organization. And since you are an agent that also maintains and creates your own benefit package, there is also non-cancelable disability income programs available through our organization that are available on a modified guarantee issue basis, where you share in the commission of your own product, and it's available to you at discounted rates. It's a great way to protect your income as part of an independent agent out there earning your living. We do offer a number of different training programs and resources, not only in conjunction with carriers such as AmeriGroup and Anthem here today, but also ways for you to reach out and market the community through different techniques and concepts that we offer. And one of the ones that pops up here in the next couple weeks is the opportunity to market through retail. Believe it or not, folks are going to have to start speaking up for different locations already, and that's part of what's on the calendar. You can not only reach out to the past presentations that we've done through our website on the recordings, but also enables you to step up and RSVP for additional trainings in the future as well. We do offer also additional electronic support that enables you to access a means to reach out and touch people remotely through different quote engines and enrollment devices that are available to you, including our Medicare Center program, where Anthem is actually one of the carriers available through that. It enables you to collect a scope of appointment remotely and store it, and it enables you to create a CRM so you can do annual reviews very simply, storing all the data compliantly that you need to. And we are introducing an additional e-app machine for multiple Medicare Supplement programs moving forward. That rollout is coming very, very soon, so watch for that as well. We do have a program as well to put your social media marketing efforts on AutoPilot through our Coverage Made Easy program. These links will take you to descriptions of that program and how you can put it in play for your agency. We do offer a full range of incentives. Many of the carriers will offer trips and additional financial incentives. It's difficult to do in the Medicare Advantage and prescription drug world since the government regulates what you can and cannot be paid. But if you work in the Medicare Supplement arena or with different ancillary products, many of those carriers offer additional incentives for you to write business with them. And Premier has a producers convention as well. Next week, a ton of folks are going to Jamaica. During that convention, they will announce the trip for 2020 as well, so that's something to keep in mind. We do also offer lead support for you. There are different custom lists available for you based on different demographics on area, age, income, parameters such as that. You can cold call for certain products. Obviously, you can't do it for Medicare Advantage or prescription drug programs, but you can for Med Sup or dental programs or final expense. Those are available to you at a deeply discounted rate or gratis, depending upon your contracting status with our organization. And we do have different programs set up to help you maximize the value you have with retail marketing. If you're one of the folks who have had a good experience with a Walmart or a CVS or a Walgreens or whatever it happens to be, it's probably because you were very industrious as how you approached that opportunity as well. We have a system that helps you maximize that opportunity. We also have programs that help you market to and through faith-based organizations and with providers, not only doctors and hospitals, but dentists and other medical professionals that actually provide the care that we help pay for through our insurance programs. Many of the carriers do offer their own generated prospects on a periodic basis. There are some that actually have it as part of their overall marketing support program. So that's something that's worth investigating, as is internet leads. We have a pilot program coming up that will soon be available to the Medicare market, is already available for folks who market for final expense. So that's something to keep in mind. And we do offer direct mail support as well. Based on production, we deeply discount the cost of mailings through our preferred lead vendors. We use lead vendors on a preferred basis simply because we have the responsibility to maintain compliant outreach, and that's how we do that. All that said and done, what we're looking for is the opportunity to work with you. We think that Anthem and AmeriGroup offers an incredible opportunity throughout the state of Texas, but particularly in North Texas, when you have choices of different programs available and strong marketing support from the carrier representatives such as Renee. And that is something that we are asking for from you, and that is the opportunity to earn that business and work with you to be successful in making it a strong revenue stream for you and your agency. That's your decision. And there's the old expression, when all is said and done, more is said than done. Well, today's a decision point. It's the old Yogi Berra, I came to a fork in the road. You got to take it. Decide to make this a part of your marketing portfolio. Let's get you contracted, certified, and ready to go. Let's make it a part of your marketing program and put it in play. That said, you can reach any of the health marketers with Premier through our toll-free number at 1-800-365-8208 or through our website at premiersmi.com. We look forward to discussions with you in the very near future. Watch for the follow-up that will be sent to you. And in the meantime, we wish you good selling. Thanks so very much for coming on the line. And Renee, thanks for your help. We'll talk to you all soon.